In 1985, Ashley McCrary started her freshman year at Auburn University.
I lived in dorm 9, which is Helen Keller, which is right next to Haley Center. I was an Alpha Gam, which is a great sorority on campus, and was really involved in that sorority. I was an officer. I was a Warrior Girl my junior and senior year. I just loved being there.
19 years after graduation, she was diagnosed with a rare form of melanoma, something most doctors have never seen before.
And we were sitting after dinner one night, and my friend Jill said, what is that spot on your eye? And honestly, I had not noticed the spot. My husband hadn't noticed the spot, but sure enough, I go and look in the mirror, and it's pretty noticeable. June 23rd, we had gone to a dinner with some oncologists, and while we were there eating, one of the wives said to me, I never noticed that spot on your eye, and it kind of took me back because it had been a month since my friend said anything. She had her husband, of course, who was a cancer doctor, look at it, and he said, you need to go see somebody right away. So I went, and sure enough, they dilated my eyes, and the doctors came in, and I could immediately tell I was an interesting case. The next thing I know, he left and got 9 doctors, and they each just sat down one at a time, didn't tell me anything, but just was looking at my eye, and I was like, okay, what's going on? And they said, well, it's likely that they'll never see this. This is such a rare thing. And I said, well, what is it?
Ocular or uveal melanoma is a very rare cancer that affects 5 in a million people in the United States every year.
He said, you're going to have your eye removed, probably have to be done in 2 weeks. And I didn't even know there was really anything wrong. And it was so shocking, and there was nothing soft about it. So we decided to go to Emory for a second opinion. And just had a lot of concern over it. I mean, I had 4 children. I can remember having to come and tell them that that's what I had, and it being very upsetting to everyone. So I was really hoping I didn't have to have my eye removed.
With any melanoma, if it's isolatable, then you want to take it out. So surgery is the thing to do. And obviously organ-sparing surgery is ideal. The eye is a very small place and a very delicate place to operate, so sometimes it's difficult to take out part of the eye without sacrificing the whole organ.
Something I haven't shared with people is my whole life people had told me, how I had my dad's eyes. I did not want to have my eye taken out. I didn't know what that would be like. And so when I went to the doctor, I was just really praying that they would tell me that I didn't have to do that. But sadly, that was not the case.
So 13 years I've been doing this. I've seen melanoma probably 40 times at the most in all those years. I've never once seen a case of uveal melanoma. It's extremely rare.
In 2012, at the time, I knew 2 other girls who went to Auburn who also had this cancer. And so the doctors were like, we need to look into this.
Coincidence or cancer cluster?
We're up to 22 people. That's a lot of people. Was there something maybe in the atmosphere, something maybe in the water? I don't know.
To me, a cancer cluster would be any type of cancer within a small geographical range. The same kind of cancer, and especially a rare kind of cancer.
So when 19 more in the Auburn family were diagnosed with this unusual cancer, it struck up interest throughout the country.
We were approached by the physicians in Philadelphia. They set up this conference at the Hotel and Conference Center, and asked all kind of questions, like literally everything from childhood on, to see what kind of connection we all have.
Well, I think it's kind of fascinating that there's that many cases. Just finding them is kind of a needle in the haystack sort of thing. It almost, to me, has to be something that happened, some sort of exposure or something in common that those patients had.
Although the cause is still unknown, many doctors throughout the United States, along with the university, are working to better understand ocular melanoma and the cancer cluster here at Auburn.
The university's response has been perfect. They have said, right now we don't know any cause. There's no reason for you to be nervous about your children being here. However, we do want to look into it, but they're more concerned about their health than they are about reputation or publicity or whatever, and I see that as a positive thing.